So, good morning, Betty. So, you're here today. How many weeks after your Achilles tendon surgery?
About 8 weeks.
About 8 weeks. And you came to me because, well, you have a very interesting story because your husband had the same situation, right?
Yes.
Many years ago. And I operated on him, probably 6-7 years ago, right?
Right.
And he had an Achilles tendonitis in both feet, right?
Right.
And we did the open surgery.
Yes.
So for a while, you guys were coming here very often because it was a big incision. He had to be in a wheelchair for 4 weeks with each leg. And so when you came to me, you were a little bit scared because you really, well, I don't blame you, but you didn't really feel like having the same open surgery as well, right?
Exactly.
So I told you that we have a new procedure that is a minimally invasive procedure with TenJet, where I go in and I remove all the inflammation from the tendon without having to open you up, fillet you open, right? And obviously you were very excited because, the old surgery required a very prolonged immobilization. And you probably remember your husband probably limped for about, 3 to 6 months after each surgery,
yes.
right?
Yes.
Well, you're sitting here today, 2 months after the surgery, and well, tell me how much pain you have now.
Zero.
Zero. So you basically, the pain in the back of the heel is completely gone?
Yes.
Are you able to wear closed-toe shoes?
Yes.
Okay. Well, now we have to fix your back, right? Which is probably because of the way you've been walking, right? Well, you had some issues before that as well. But for people who are debating about having the old surgery and the new surgery, what do you think? Which one would you recommend?
Oh, there's no question. The less invasive.
Right.
The recovery has been incredible.
Right. Did you have a lot of pain after the surgery?
Very little. I think I took one pain pill the whole time.
So you would recommend it for your friends and family?
Highly recommend it.
Right. I'm sure your husband is like, oh my God, I should have waited for a couple of years for...
He said that. He said, I can't believe the difference.
Right. Well, listen, for the first, 15 years of my practice, I didn't have a choice. I had to do the old surgery because that was the only way. But I can tell you, as I always said, there will be a day when they will come out with a minimally invasive surgery for this. And finally they did. So, for the past 3 years, I've been doing this new procedure, and I can tell you is I will never go back. And, statistically, it's not 100%. You always probably will have like 10 to 5% of patients who will need that open operation. But listen, the recuperation and the risks associated with an old surgery were definitely significantly higher comparison to the new one.
Would have to be, yeah.
Yes. Well, thank you so much for your testimony.
Thank you.